Hey, lovely people. Welcome to Learning with Violet or Culture. How are we all doing? I know we're doing fine. In today's video, we are going to be talking about recently most common and most popular medications used in Osce exam so that you are aware and you are definitely going to get a pass if you know this recently commonly frequently used medication in Osce exam. So, guys, if you are meeting me for the very first time, my name is Violet Okalacha. I'm a registered nurse. I live and I practice in the United Kingdom. And on this channel, I share every beautiful tips to make you pass your OSCE exam. Thanks to a lot of my OSCE students who have been like, Nurse V, you've not been doing some OSCE videos. Yes, that's true. But that's because I had a lot of OSCE students I've been mentoring and tutoring. A lot of people shared with me that they had receipts, especially those who had implementation and some other receipts, and so there were over 50 of them. So we just had to sit down and say, okay, what happened that made you had receipts? And so I just have to have like online class with them, and luckily they've all passed their receipt exam. So besides that, I got over 78 mails in the last 2 weeks of those who took their OSCE exam. I passed my OSCE exam in first sitting, so I'm super proud of you all who has passed your OSCE exam. And if you're preparing to write your OSCE exam soon, oh my god, the exam is really simple. Like I always say, OSCE is simple and nurses are brilliant. You would definitely smash it, trust me. Make sure to practice with your friends, make sure to practice with your peers, and I can't wait to congratulate you. So do me a favor, guys, please share this video with everybody who you know is preparing for OSCE exam. It is vital. My videos have helped a lot of nurses. They are easy, straight, and simple. So share the video with your friends who are preparing for OSCE exam. Make sure to subscribe to this channel. Make sure to like this video, and as well make sure to share it. And if you have any issues with OSCE exam, just message me. As we had this issue, don't go and fail and fail and fail. No, if you fail your OSCE exam, try to keep an email for me, and let's see how we can help you. All right. So without wasting any time, let's dive directly into our topic for today. Thank you.
Ryan Little.
Hey guys, so welcome back to my channel. I'm super excited and super proud of you all who has passed your OSCE exam. Bless you all. More than the sky is definitely your limit, okay? And for those writing soon, I can't wait to congratulate you. So guys, give me a favor, like this video, share this video, and don't forget to subscribe. All right, so now most recent, most popular, most frequently used drugs in your OSCE exam. Now let's start with what we call Alzheimer's disease. So if you are having Alzheimer's disease in your OSCE exam, look out for donepezil, look out for citalopram. Now what does donepezil do? Donepezil is actually used to improve mental function, okay? Don't speak big grammar. Like I always say, when you read out the drug, this is tab donepezil 5 milligram, the dosage is BD, frequency is blah blah blah, doctor signature and blip number is there. All right, so Mrs. Haley, donepezil is actually used to improve your mental function, okay? And the side effects of this medication is headache, nausea, vomiting, and dizziness. And of course, the most common side effect of all medications is headache, nausea, vomiting, dizziness, okay? So that's all. So don't make the grammar too big for you. The next drug is citalopram. Yes, citalopram, you also have it if you're doing a pill or a station or an assessment on Alzheimer's disease. All right, so citalopram is actually used to treat is an antidepressant. It's used to treat depression, okay? The side effect remains headache, nausea, vomiting, and dizziness. Now guys, remember to tell the patient what their drugs are used for and the side effect, because if you forget, it's going to be a fail, okay? So always remember that. Now if you have something like asthma, cardiac, pneumonia, and so you'll be having drugs like amlodipine, lisinopril, lotasium potassium. So amlodipine, lisinopril, lotasium potassium. All right, these drugs are used to treat high blood pressure. Like I said, keep it simple. The side effects of this medication is headache, nausea, vomiting, and dizziness. And you get a tick from your assessor. That's all you need to do. You don't have to say it's an anticholinergic. No, just keep it simple. Remember, you're dealing with the patient, okay? So all those drugs, amlodipine, lisinopril, lutetium potassium, they are all group of drugs used to treat high blood pressure or antihypertensive. All right, and the antihypertensive, and the side effect is headache, nausea, vomiting, and you get a tick from your assessor. Another drug commonly used is bisoprolol. We all know what bisoprolol is used for. It's a beta blocker, but you don't have to say it's a beta blocker. Bisoprolol is used to treat arrhythmias, or what we call high heart rates. Of course, the side effect remains headache, nausea, vomiting, and dizziness. Okay, and that's enough to get a tick. So before you give antihypertensive drug, please make sure to ask the patient of their blood pressure. All right, don't dispense the drug first. After reading your prescription, ask yourself, do I need to ask the patient of their blood pressure, or do I need to ask the patient of their blood glucose? Okay, so when you're giving antihypertensive drug, ask them of their blood pressure. Now, if their blood pressure is below 120/80, you have to code the medication. Now, in this Osce exam, there are different codes. Okay, you can give it a code of 10 and you state why you are giving it a code of 10. Okay, code of 10 means other reasons. So because you're giving it a code of 10, you state exactly why you're giving it a code of 10, other reasons. And so you give it a code of 10, and anytime you code a medication, code it 10, write your date and write your signature. Then quickly run to the back of your drug chart, write your date, write your time, write the reason you are coding the medication, which happens to be 10, and of course write the dosage, the time, the milligram, and write your what, and write your signature. So code of 10 means other reason why you are not giving it. Okay, you can give it any code. You can also give it code of 9. Code of 9 means low blood pressure or low pulse. So it's up to you to decide either to give it a code of 9 or to give it a code of 10. But the main thing is, if a patient blood pressure is below 120/80, do not administer the antihypertensive medication. Just code it. You can administer the antihypertensive medication if you tell the assessor, my patient said her blood pressure is 110/70. I'm not happy to give her antihypertensive. I am just going to code it a code of 9 or a code of 10. And the assessor says, Violet, please, the doctor wants her to have antihypertensive medication. Please go ahead and give. On that ground alone, you can go ahead and give. Does that make sense, please? All right. Now, so before you give a drug like bisoprolol, remember bisoprolol is used to treat arrhythmias. You don't have to say it's a beta blocker. You don't have to speak too much English. Just make it simple. Bisoprolol is used to treat anti-arrhythmias or used to treat arrhythmias. The side effect remains nausea, vomiting, and dizziness. Before you give a drug like bisoprolol, make sure you know the patient's heart rate. Normal heart rate is 60 to 90, right? So if the patient's heart rate is below 60, you can't give. You have to give it a code of 9, you have to give it a code of 10. And remember, when you are coding the medication, make sure to sign, make sure to put your make sure to sign and make sure to put your date. Then go to the last page of your drug chart where it states omitted dose of medicine. Write the date, write the drug, write the route, write the time, write the reason you omitted the medication, and of course put down your signature. All right, guys. So other medications you might be having are digoxin, atenolol. These drugs are used to treat what their cardiac glycoside. Okay. So digoxin is used to treat arrhythmias. And before you give a drug like digoxin bisoprolol, like we said, make sure to know the patient's heart rate and as well as blood pressure. And the heart rate is below 60, you can't give it, okay? You have to code it. And like I said, when you code a medication, make sure to write the code. Either you're giving it a code of 9, which is low pulse or low blood pressure. You are giving it a code of 10, or you state other reasons. And you put your signature initials and you go to the last page of your drug chart. And when you get to the last page of your drug chart, you write the date, You're supposed to give the drug, you write the time you're supposed to give the drug, and of course, you write the route, the dose, and you write the time, you write the reason why you're omitting the drug, and of course, you put your signature. Okay, so now atenolol is used to treat, of course, high blood pressure, chest pain. So you have to know the patient blood pressure before you give the medication, and you also have to tell the patient their side effects. Okay, so Ramipre, lisinopril, they are all antihypertensive. We all know that. So other drugs is furosemide. Furosemide is a diuretic. All right. It is used to also treat high blood pressure, and it gets rid of excess water in the body or excess fluid in the body. Tell the patient the side effect is headache, nausea, and vomiting. And before you give a drug like furosemide, it is important to know the patient blood pressure. Spironolactone is similar to furosemide. It is also used to get rid of excess fluid in the body. Side effect remains headache, nausea, vomiting, and dizziness. Now, also know the patient blood pressure before you give drugs like furosemide, okay? And if it's below 120/80, like we said, you have to code it unless the assessor tells you the doctor wants the patient to have the medication. Now, there are other drugs like antibiotics, amoxicillin, clarithromycin, coamoxiclav. These are all antibiotics. Please, if a patient is on antibiotics or antimicrobial, make sure to check the patient's allergy before you give. For instance, if a patient is allergic to penicillin, you cannot give amoxicillin, you cannot give coamoxiclav. You have to give it a code. So you can give it a code of 10 other reasons and state why you're not giving it, that patient is allergic to the medication. Okay, so if a patient is allergic to amoxicillin, if a patient is allergic to penicillin, if a patient is allergic, you can't give this drug. Patient is allergic to amoxicillin, you can't give amoxicillin. If the patient is allergic to penicillin, you can't give amoxicillin, you can't give coamoxiclav. You can't give any drug containing penicillin. Okay, does that make sense? So for antibiotics generally, before you give, make sure to check that the patient is not allergic to that antibiotics. Now, another thing I want to say, if a patient is allergic to penicillin, please go ahead and give clarithromycin. Clarithromycin does not contain penicillin, because if you say to the assessor, my patient is on clarithromycin, but I'm not happy to give because it contains penicillin, the assessor is going to fail you, because clarithromycin is an antibiotic, but it does not contain penicillin. Does that make sense, guys? So those are the common antibiotics used in Osce exam. Other medications used in Osce exam are omeprazole, lansoprazole. Omeprazole and lansoprazole, they are used to treat gastric ulcer. Like we said, keep it simple. The side effect is headache, nausea, vomiting, and dizziness. And before you give, always make sure you tell the patient what the drug does as well as the side effects of the medication. Now, other medications uses oxybutynin. Oxybutynin, we all know it is used to treat overactive bladder, and the side effects of oxybutynin is headache, nausea, all drug side effects generally. Then there's another drug called bentroflumetazide. It comes out frequently, is a diuretic, and it is used to treat high blood pressure. Bentroflumetazide. So think about bentroflumetazide, think about Ramipre, think about lisinopril, think about all the blood pressure medication they are used to treat antihypertensive, and the side effect is what? Headache, nausea, and vomiting. Now, other medications you might want to consider is calcium carbonate. Calcium carbonate is a commonly used medication in your OSCE exam. So now, what does calcium carbonate do? Calcium carbonate, they are drugs generally used to treat what? Low calcium. Calcium carbonate is the drug used to treat low calcium in the body. They're also used to treat chronic kidney disease. And of course, the side effect is headache, nausea, vomiting, and dizziness. There are other medications which we classify as what? Ferrous fumarate. Ferrous fumarate is a very common medication used in OSCE exam, and they are used to treat and prevent iron deficiency anemia. And again, the side effect is headache, nausea, vomiting, and dizziness. All right. So other medications used again is ferrous sulfate. Ferrous sulfate is also used to treat what? Is also used to treat iron deficiency, anemia, and the side effect remains headache, nausea, vomiting, and dizziness. We have a popular medication called metformin. Metformin is used to treat high blood sugar. The side effect again remains headache, nausea, vomiting, and dizziness. And we have some analgesic like ibuprofen, analgesic like paracetamol, analgesic like codeine, analgesic like aspirin. So we all know what paracetamol is used for. Paracetamol is used to treat pain. We all know what ibuprofen is used for. It's a non-steroidal anti-inflammatory drug, and of course it is used to treat pain or any inflammatory reaction. And again, remember that all drug side effect is headache, nausea, vomiting, and dizziness. And codeine is used to treat pain. All right, so these are the common popular medication. And we have other medications like sertraline. Sertraline, you will get it if you have PHQ-9. So if you have PHQ-9, you will definitely get sertraline. Sertraline is an antidepressant. Okay, the side effect remains headache, nausea, vomiting, and dizziness. There are other popular medications like ondansetron. Ondansetron is used to treat and prevent vomiting. Side effect is headache, nausea, vomiting, and dizziness. Then we have other medications we call cyclizine. Cyclizine is a popular medication. And what is cyclizine used for? Cyclizine is an anti-sickness medication or antihistamine medication. It prevents nausea, vomiting, or it is used to treat nausea, vomiting, and the side effect remains headache, vomiting, and dizziness. Then we have some simvastatin. Simvastatin is used to treat high blood sugar. Simvastatin is used to treat high cholesterol in the body. All right. So the side effect remains headache, nausea, vomiting, and dizziness. We have a popular medication called levothyroxine. Levothyroxine is used to treat underactive thyroid gland. Side effect is headache, nausea, and vomiting. So these are commonly popularly used medication in your Osce exam, so you have to know them. So what are the popular code if I'm not giving a medication? So the popular code are code of 5. Code of 5 means the patient has had start dose given at the start of the drug chart. So if the same medication at the start dose of the drug chart is repeated on the regular medication, you have to give it a code of 5, which means start dose given. So the popular code in this new case, code of 5, code of 9, and of course code of 10. All right, code of 5 start dose given, code of 9 low blood pressure or low pulse, and code of 10 is other reasons. And so you have to state the reason at the back of the drug chart where it states omitted medicine. So guys, these are all the commonly used medication in your Osce exam. Let me know if I miss anyone. I don't think I did. Nitrofurantoin is one of another good medication. It is used, it's an antibiotic, and of course it is used to treat and prevent infection. So these are the commonly medication used in Osce exam. So thank you for watching. Do where to share, do where to subscribe, and I will see you in another video of dying patients. And until I see you again, keep passing your Osce exam. I love you all. Bye for now. And of course, remember aspirin. Aspirin is another popularly used medication. So I'll run through them for you. We have the Donepezil, citalopram, levothyroxine, paracetamol, amlodipine, bisoprolol, digoxin, ramipril, atenolol, losartan, potassium, furosemide, amoxicillin, clarithromycin, metronidazole, an antimicrobial, of course, used to treat infection and prevent infection. Omeprazole, lansoprazole, used to treat gastric ulcer. Oxybutynin, used to treat overactive bladder. Calcium carbonate, used to treat low calcium. Ferrous fumarate, ferrous sulfate, used to treat iron deficiency, anemia. Metformin, used to treat high blood sugar. Codeine, used to treat pain, which is an opioid. Ibuprofen, used to treat pain, which is a non-steroidal anti-inflammatory drug. And of course, simvastatin, used to treat high cholesterol. We have cyclizine, ondansetron, metoclopramide. These are antihistamine that are used to treat and prevent vomiting. And all these drugs, we said their side effect is headache, nausea, and vomiting. And of course, sertraline, we said it is an antidepressant. All right, guys. Bye for now. Keep passing your Osce exam. I love you all. Bye.